आज हम इस बुक को देखेंगे जिसका बुक का नाम है मेडिकल सर्जिकल नर्सिंग, जो कि इसका एडिशन है साउथ इंडियन एडिशन। और इसके ऐसे ही एडिटर हैं सुरेश के शर्मा एंड एस माधवी। एंड हाईलाइट किस पे किया गया है is the highlighting on this book is the complete coverage of content as per the Indian Nursing Counseling INC syllabus, new chapter and relevant content from the Indian South Asian perspective. Indian Counseling of Asian Epidermal is disease and the sequential arrangements of chapter as the MSN first and the second circulum. This book is given by the Bruno and Siddharth. Let's talk about the volume 2 syllabus. First chapter is kidney and urinary tract function. In the kidney and urinary tract function, we have discussed about assessment and kidney and urinary function, management of patient with kidney disorder, and the second one is third reproductive function. In the male reproductive function, the assessment and management of patient with a male reproductive disorder. And next one is integumentary function. In the integumentary function is assessment of integumentary function, management of patient with dermatologist and disorder. And next one is musculoskeletal function. In the musculoskeletal function, we have discussed about the assessment and musculoskeletal function and the musculoskeletal care and modalities. And then management of patient with musculoskeletal disorder, management of patient with musculoskeletal trauma. And next is immunologic function. Is in the immunologic function is assessment of immune function, is management of patient with immune deficiency disorder, and assessment of management patient with the allergic disorder, assessment and management with the patient with a rheumatic disorder, communicable and the infection disease, is management of patient with a communicable and infectious disease. And next is sensory function. In the sensory function, we have discussed about the assessment and management of the patient with a nose and throat disorder, assessment and management of the patient with a hearing and the balance disorder, assessment and management of the patient with the eye and vision disorder. And next is the neurological function, is assessment of neurological function, assessment of patient with the neurologic dysfunction, management of the patient with the cerebral disorder, management of patient with the neurologic trauma, management of the patient with neurologic infection, autoimmune disorder and the neuropathies, management of the patient with the oncologic or the degenerative neurological disorder. And the next is female reproductive function, assessment and management of the patient with the female psychological process, management of the patient with the female reproductive disorder, assessment and management of the patient with the breast disorder. And next is burn and reconstructive and the cosmetic surgery. In the burn and reconstructive surgery, we have discussed about the assessment and management of the burn injury and the reconstruction of the cosmetic surgery. And then is oncologic nursing, management of patient with oncologic disorder and end life care. Next is the acute community and based challenges. In the acute community based challenges is emergency nursing, terrorism, mass casualty, disaster nursing. And next is the care of elderly. In the care of elderly, we check about the health of the older adult. Critical care nursing is a assessment and management of the patient with a critical illness. And next is occupational and the industrial care, is the management of the patient with occupational and industrial care. Today we have learned about the Guillain-Barré syndrome, जिसे हम लोग कहते हैं GBS. GBS is also known as acute idiopathic is the polyneuritis. It is an autoimmune attack on the peripheral nerve myelin. The result is acute rapid segmental demyelination of the peripheral nerve and the cranial nerves and producing the ascending weakness. It is dyskinesia. What is the meaning of dyskinesia? Dyskinesia is the meaning of inability to execute voluntary movement. Voluntary movement inability to is and what is voluntary movement and is involuntary movement. In the voluntary movement, we movement anything the part of the body by self, and involuntary movement we cannot have any coordination. It can be by itself, like the pupil of the eye, in the gastric like the movement of intestine, or the respiratory system, inhalation and exhalation by the air of the air, and many more is the involuntary movement are there, but it is given there the egg is a voluntary movement, like the movement of hand, to do the things from like this, it's a voluntary movement which control which we are control. Okay. And the hyporeflexia and the paresthesia and the sensation and the numbness is the paresthesis is the sensation and the numbness. Okay. Participate in the clinical presentation is up to 60 to 70% of cases is bladder 2016 is the Campylobacter jejuni. This is the Campylobacter is the causes of disease is Campylobacter jejuni. It's very important. It's mark this bacteria name is Campylobacter jejuni is very important to cause the disease. Like the given as 60 to 20% in cases of Campylobacter jejuni is 60 and 24 to 50% cases is cytomegalovirus, in Epstein-Barr virus, in Mycoplasma pneumonia, and S. influenza. HIV are the most common infection agent, and they are associated with the development of the GBS. Okay. There are several types of GBS, with the most well-known type the patient is the experience weakness in the lower extremities, and the progress of upward inhale the potential for respiratory failure. The second type is purely motor with no altered sensation, and the third type is the descent, and GBS is much more difficult to diagnose. Here it's given the three types of the GBS type. In the third, what is given here in the third. The third is a descending DBS is much more difficult to diagnose. It mostly affect the head and neck muscle. In the third it mostly affect the head and in the upper areas, upper head and neck muscle, and the rarest type, and it is rarest type, and the Milter frame variant present in with attack in the Milter feature. And the Milter feature is ataxia and ophthalmomegalia is ataxia. What is ataxia? Ataxia is the difficult in the moving, and the patient complain to the slipping down towards the right side or the left side, whatever it depend on the situation. The annual incidence of GBS is 1 to 2 cases per 1 lakh people.